Hi friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, in today's video we are cover some important and basic MCQs on the basis of biochemistry and clinical pathophysiology. The pharmacy first year. This MCQ is important for gpat exam or msbte annual exam. So friends, please watch this video till the end. Let's start. Question number first. The sucrose is a the sucrose is a option A monosaccharide, option B disaccharide, option C polysaccharide, and option D none. The correct answer is option B a disaccharide. The sucrose is a disaccharide. Question number second. Lactose on hydrolysis gives which products? Option A glucose plus glucose. Option second glucose plus fructose. Option C glucose plus galactose. And option D none. The correct answer is option C glucose plus galactose. Glucose are same in all three compounds, but galactose means lactose. The correct answer is option C glucose plus galactose. Lactose on hydrolysis gives glucose plus galactose. Question number third. BCG vaccine should be given at the age. Option A at birth. Option B at 6 months. Option C at 1 year. And option D at second year. The correct answer is option A birth. BCG vaccine should be given at the time of birth. Question number 4. Richest source of lecithin is option A meat, option B egg yolk, option C fish, and option D milk. The correct answer is option B egg yolk. Richest source of lecithin is egg yolk. Question 5. The normal level of calcium in blood plasma is option A 20 to 40 mg per 100 ml of blood. Option B 30 to 40 mg per 100 ml of blood. Option C 9 to 11 mg per 100 ml. And option D 100 mg per 100 ml of blood. The correct answer is option C 9 to 11 mg plus per 100 ml of blood. The normal level of calcium in blood plasma is 9 to 11 mg per 100 ml of blood. Question number 6. Which is the smallest amino acid? Or give the which of the following is the smallest amino acid? Option A phenylalanine, option B alanine, option C valine, option D cycline. Correct answer is option D cycline. Cycline is the smallest amino acid, or these are the example of smallest amino acid. Question number 7. Which enzyme is useful for the clinical diagnosis of acute pancreatitis? Option A lipase enzyme, option B amylase, and option C creatinine phosphokinase, and option D both A and B, that means both lipase and amylase. The correct answer is option D both A and B. That means lipase and amylase enzyme is useful for the clinical diagnosis of acute pancreatitis. Question number 8. Enzyme used in the treatment of cancer. That means which enzyme is used in the treatment of cancer, which are as follows. Option A protease enzyme, option B lipase enzyme, option C asparginase enzyme, and option D amylase enzyme. Correct answer is option C asparginase enzyme is used in the treatment of cancer. Question number 9. Enzymes are made up of. That means what are the primary substance products of enzymes? Option A lipid, option B fat, option C protein, and option D none. Correct answer is option C protein. Enzymes are made up of protein. Question number 10. Sakaguchi test is specified to option A glycine, option B tryptophan, option C arginine, and option D tyrosine. Correct answer is option C arginine. Sakaguchi test is specified to arginine. Question number 11. The end products of glycolysis in aerobic condition is. What is the end products of glycolysis in aerobic condition? Option A pyruvate, option B malate, option C succinate, and option D none. Correct answer is option A pyruvate. The end products of glycolysis in aerobic condition is pyruvate. Question number 12. The precursor of vitamin D is. What is the precursor of vitamin D? Option A, fatty acid. Option B, sterol. Option C, cholesterol. And option D, lipid. Correct answer is option C, cholesterol. The precursor of vitamin D is cholesterol. Question number 13. Name the vitamin deficiency of which leads to rickets or rickettsia. Option A, vitamin B. Option B, vitamin D. Option C, vitamin C. And option D, vitamin A. Correct answer is option B, vitamin D. Vitamin D deficiency which leads to rickets or rickettsia. Question number 14. Presence of starch can be detected by which method? Presence of starch can be detected by which method? Option A, iodine test. Option B, Mollis test. Option C, Thomas test. And option D, Benedict test. Correct answer is option A, iodine test. Presence of starch can be detected by which of method? This method is a iodine test. Question number 15. Barfoed's reagent is a solution of. Barfoed's reagent is a solution of. Option A, copper sulfate. Option B, copper acetate in acetic acid. Option C, cupric tartrate. And option D, cupric nitrate. Correct answer is option B. Barfoed's reagent is a solution of copper acetate in acetic acid. Question number 16. Which of the following is a heteroglycan? Which of the following is a heteroglycan? Option A, starch. Option B, cellulose. Option C, glycogen. And option D, hyaluronic acid. Correct answer is option D, hyaluronic acid. Hyaluronic acid is a heteroglycan. Question number 17. Yeast is the richest source of. Option A, vitamin C. Option B, vitamin B. Option C, vitamin D. And option D, vitamin A. Correct answer is option B, vitamin B. Yeast is the richest source of vitamin B. That means yeast contain a large amount of vitamin B. Option A, casein is an example of which proteins? Option A, nucleoproteins. Option B, phosphoproteins. Option C, chromoproteins. And option D, gallic acid. Correct answer is option D, gallic acid. Casein is an example of gallic acid. Question number 19. Which of the following is an example of non-essential amino acid? Friends, we have seen amino acids are classified into two types, essential amino acids or non-essential amino acids. But their question is, which of the following is an example of non-essential amino acid? Option A, valine. Option B, histidine. And option C, glycine. Option D, arginine. Correct answer is option C, glycine. Glycine is an example of non-essential amino acid. Remaining are the example of essential amino acids. That's simple. Question number 20. Example of major minerals. Option A, calcium. Option B, magnesium. Option C, potassium. Option D, all of above. Correct answer is all of above. Because calcium, magnesium, potassium all are the examples of major minerals. Question number 21. Which of the following can be given for good bone health? Option A, vitamin A. Option B, vitamin D. Option C, vitamin C. And option D, vitamin E. The correct answer is option C, vitamin C. Vitamin C can be given for good bone health. Or also vitamin D is given. Question number 22. Ribose is a constituent of. Option A, nucleic acid. Option B, ascorbic acid. Option C, lactic acid. And option D, formic acid. The correct answer is option A, nucleic acid. Ribose is a constituent of nucleic acid. Question number 23. A rising creatinine level indicates. A rising creatinine level indicates. Option A, psoriasis. Option B, hypopituitarism. Option C, obstructive jaundice. And option D, kidney damage. Correct answer is option D, kidney damage. A rising creatinine level indicates kidney damage. Question number 24. What is the source of carbon atoms in cholesterol? What is the source of carbon atoms in cholesterol? Option A, acetyl-CoA means coenzyme. Option B, lanosterol. Option C, choline. And option D, mevalonic acid. The correct answer is option A, acetyl-CoA. Acetyl-CoA is the source of carbon atoms in cholesterol. Question number 25. Flavin mononucleotide is the coenzyme of. Flavin mononucleotide is the coenzyme of option A, thiamine, option B, riboflavin, option C, niacin, and option D, none. Correct answer is option B, riboflavin. Flavin mononucleotide is the coenzyme of riboflavin. Question number 26. The general test of carbohydrate is, that means identification test. What is the general identification test of carbohydrate? Option A, Morris test. Option B, iodine test. Option C, Thomas test. Option D, Benedict test. Correct answer is option A, Morris test. The general test of carbohydrate is Morris test. Question number 27. Mevalonic acid formation is catalyzed by the enzyme. That means which enzyme is useful for the formation of mevalonic acid? Option A, acetyl-CoA. Option B, mevalonate kinase. Option C, HMG-CoA reductase. And option D, phosphomevalonate. Correct answer is option C, HMG-CoA reductase. Mevalonic acid formation is catalyzed by the enzyme is HMG-CoA reductase. Question number 28. Scurvy is the deficiency symptom of vitamins. Option A, vitamin A. Option B, vitamin D. Option C, vitamin E. And option D, vitamin C. The correct answer is option D, vitamin C. Scurvy is the deficiency symptoms of vitamin C. Question number 29. Example of an antioxidant. Option A, caffeine. Option B, orange. Option C, doxydab. And option D, gallic acid. Correct answer is option D, gallic acid is the example of antioxidant. Last question. Question number 30. Reagent used for the identification of cellulose. Reagent used for the identification of cellulose. Which reagent is useful for the identification for cellulose? Option A, Vanuk's reagent. Option B, Zessel reagent. Option C, Fehling's reagent. And option D, Dragon-Tropsch's reagent. Correct answer is option B, Zessel reagent. Reagent used for the identification of cellulose is Zessel's reagent. Thanks for watching full video till the end. And don't forget to subscribe our YouTube channel for pharmacy related daily videos. Please give like, share and comment on our videos in below. Thank you guys. Let's see once again in first all questions in just 2 minutes. Reagent used for the identification of cellulose is Zessel's reagent. Gallic acid is an example of antioxidant. Scurvy is the deficiency symptom of vitamin C. Mevalonic acid formation is catalyzed by the enzyme HMG-CoA reductase. The general test of carbohydrate is Morris test. Flavin mononucleotide is the coenzyme of riboflavin. Acetyl-CoA of carbon atoms in cholesterol. A rising creatinine level indicates kidney damage. Ribose is a constituent of nucleic acid. Vitamin D can be given for good bone health, or vitamin C also. Example of major minerals is calcium, magnesium, potassium, all of. Glycine is an example of non-essential amino acid. Glycine is a example of non-essential amino acid. Casein is an example of gallic acid. Yeast is the richest source of vitamin B. Hyaluronic acid is a heteroglycan. Barfoed's reagent is a solution of copper acetate in acetic acid. Presence of starch can be detected by which method? This method is a iodine test method. Vitamin D deficiency which leads to rickettsia. The precursor of vitamin D is cholesterol. The end products of glycolysis in aerobic condition is pyruvate. Sakaguchi test is specified to arginine. Enzymes are made up of protein. Enzyme used in the treatment of cancer is asparaginase. Which enzyme is useful for the clinical diagnosis of acute pancreatitis? This enzyme is lipase and amylase. Cyclin is the smallest amino acid. The normal level of calcium in blood plasma is 9 to 11 mg per 100 ml of blood. Richest source of lecithin is egg yolk. BCG vaccine should be given at birth. Lactose on hydrolysis gives glucose plus galactose, and the sucrose is a disaccharide. So friends, in today's video we will cover some important MCQs on the basis of biochemistry and clinical pathophysiology, all the chapters, carbohydrates, proteins, amino acids, hospital, etc. etc. Thank you guys. Let's meet in next videos.